Hello everyone, welcome back to my channel. I'm Pharmacist Okoli, and very quickly we'll be looking at sex-related cancers. That's to say, cancers that might develop due to viruses transmitted during sex. It's really going to be an enlightening experience, so please stay tuned. A number of cancers have been known to be caused by viruses that can be transmitted during sex. Should you be worried? Yes. In fact, viruses cause an average of 15% of all human cancers worldwide, and this obviously represents a significant portion of the global cancer burden. There are 7 viruses transmitted during sex that opens you up to cancer, and they include the HPV, which is the human papillomavirus, the EBV, Epstein-Barr virus, the hepatitis B virus, the hepatitis C virus, the HTLV1, known as the human T-cell leukemia virus type 1, the HHV8, known as the human herpes virus type 8, and finally the HIV, that is the human immunodeficiency virus. Of the 7 listed viruses, HPV has the highest likelihood of giving rise to cancer. Of course, we know that cancer is simply a disease in which cells in the body grow out of control. Cancer is always named depending on the body part where it starts, even if it spreads to other body parts much later. For example, if it starts at the breast, it will be called breast cancer. If it originates within the cervix, it will be called cervical cancer. The HPV, the human papillomavirus, is the most common sexually transmitted infection. It is transmitted through vaginal, anal, or oral sex, and it can also be passed on by intimate skin-to-skin contact with an infected person. It's important to know that a person with HPV can conveniently distribute the infection to everyone they are sexually intimate with, even when they have no signs or symptoms. And so if you enjoy exploring different forbidden zones or private parts, it is most likely you've abundantly received different strains of the human papillomavirus. And because symptoms may not develop immediately, it becomes difficult to figure out from whom and when it became a resident in your body. There are over 200 types of HPV. Some don't cause any symptoms, some cause skin or genital warts, and the more aggressive ones can cause cancer in both men and women. This includes cervical cancers, throat cancers, anal cancers, the vaginal, vulval, and penile cancers. And so it's very vital to know that when this human papillomavirus unfortunately becomes your tenant, it takes years for it to disrupt the cellular architecture of that region where it lodges, which then manifests as cancer. Actually, it is the type of HPV that unluckily finds you that will determine if you might develop cancer in the future. And so we have what is called the high-risk types and the low-risk HPV types. The low-risk HPVs mostly do not cause any disease. However, a few low-risk HPV types can cause warts on or around the genitals, the anus, the mouth, or even the throat. The high-risk HPVs are a different kettle of fish. They can cause several types of cancer. In fact, there are about 14 high-risk HPV types. 2 of these, the HPV type 16 and the HPV type 18, are responsible for most HPV-related cancers. So these are the real bad guys. And importantly, the types of HPV that can cause genital warts are not the same as the types that can cause cancer. Most people who become infected with HPV do not know they have it. Usually, the body's immune system gets rid of the HPV infection naturally within 2 years. This is true of both the high-risk and the low-risk HPV types. And this stands to also mean that when a person's immunity is compromised for a prolonged period, and he or she is already a carrier of HPV infection or just acquired it, it becomes easier for the HPV infection to cause warts or cancer depending on the type of HPV one is carrying. Little wonder why patients with AIDS easily come down with virus-related cancers. Research is still being done to understand how and to what extent HPV causes these cancers. In general, HPV is thought to be responsible for more than 90% of the anal and cervical cancers, about 70% of the vaginal and vulvar cancers, and about 60% of penile cancers. Cancer in the back of the throat traditionally have been believed to be caused by tobacco and alcohol, but recent studies show that about 60% to 70% of cancers of the throat may not be linked to HPV. Many of these may be caused by a combination of tobacco, alcohol, and HPV. Worldwide, the burden of HPV-related cancer is truly perturbing. High-risk HPVs cause about 5% of all cancer worldwide, with an estimated 570,000 women and 60,000 men getting an HPV-related cancer each year. Cervical cancer is among the most common cancers and the leading cause of cancer-related deaths in low and middle-income countries, where screening tests and treatment of early cervical cell changes are not readily available. When the body's immune system can't get rid of an HPV infection with high-risk HPV types, it can linger over time and turn normal cells into abnormal cells and then cancer. About 10% of women with HPV infection on their cervix will develop long-lasting HPV infections that put them at risk for cervical cancer. The precancerous cell changes caused by a persistent HPV infection at the cervix rarely cause symptoms, which is why regular cervical cancer screening is important. Similarly, when high-risk HPV lingers and infects the cells of the vulva, the vagina, the penis, or anus, it can also cause precancerous cell changes. Precancerous lesions at this size in the body may eventually develop into cancer, causing symptoms like bleeding, pain, or swollen glands. However, these cancers are much less common than cervical cancer. Little is known about how many people with HPV will develop cancer in these areas. There is basically no blood test to find out a person's HPV status. Also, there is no approved HPV test to find out HPV in the mouth or throat, but you can find out if there is HPV in your cervix as a woman. Pap tests can also be done to figure out if there are precancerous or cancer cells in the cervix. In fact, currently, CDC recommends that it be done from age 21. Most people with HPV do not know they have the infection. They never develop symptoms or health problems from it. However, some people find out that they have HPV when they get genital warts. Women may find out that they have HPV when they get an abnormal Pap test result during their cervical cancer screening. Others may only find out once they've developed more serious problems from HPV, such as cancers. HPV is so common that almost every sexually active person will get HPV at some point if they don't get vaccinated. Nearly all sexually active people are infected with HPV within months to a few years of becoming sexually active. Around half of these infections are with a high-risk HPV type. You can do several things to lower your chances of getting HPV. 1. Get vaccinated. The HPV vaccine is safe and effective. It can protect against diseases including the warts and cancers caused by HPV. Get screened for cervical cancer. Routine screening for women aged 21 to 35 years old can prevent cervical cancer. If you're sexually active, use condoms the right way every time you have sex. This can lower your chances of getting HPV, but HPV can infect areas the condom does not cover. So condoms may not fully protect against HPV, and that's why it's preferable to be in a mutually monogamous relationship. In other words, only have sex with your spouse. Yes. The HPV vaccine series is recommended for girls and boys at the age of 11 or 12, and the series can be started at age 9. It's important for males as well as females to get vaccinated. because both men and women can develop cancers of the mouth and throat, anal cancers, and even genital warts. Women are also at risk for cervical cancer and men for penile cancer. Vaccination can also reduce the spread of HPV that causes cancer to other people too. Children who start the vaccine series before age 15 need 2 doses to be protected, while those who receive their first dose at age 15 or older need 3 doses to be protected. For young people who weren't vaccinated within the age recommendations, HPV vaccination is recommended up to age 26. Vaccination is not recommended for everyone older than age 26 years. This is because if you've been sexually active by age 26, you must have been exposed to the HPV virus. However, some others aged 27 through 45 years who are not already vaccinated may decide to get the HPV vaccine to prevent new HPV infections and enjoy the possible benefits of vaccination. At any age, having a new sex partner is a risk factor for getting a new HPV infection. People who are already in a long-term mutually monogamous relationship are not likely to get a new HPV infection. We've come to the end of this video, and at this juncture, I want to say thank you for watching, and please do hit the like button below, subscribe, share, and turn on the notification bell so that you would be notified as more videos are in the pipeline. Do remain a health lover. Cheers.